I'm Lynn McComas, and I'm a nurse practitioner, and I'm also the owner of PreceptorLink. And I'm here today with my colleague.
Hi, I'm Lori Sargent, and we work together on the preceptor problem, the problem for students finding preceptors for their clinical rotations.
Yeah, we're really passionate about this. In fact, we recently coined a new disorder called Preceptor Search Traumatic Stress Disorder. And even though this is kind of a tongue-in-cheek thing that we say, we really do understand that students are really struggling to find preceptors. And so today we thought we would try to give you some practical tips on looking for a preceptor.
Yeah. And one of the things I thought we would do is I'm just going to ask Lynn some questions that are based on our experience in finding preceptors for students and helping them. So we'll just dive right in here. So Lynn, what kind of advice do you have for students who are searching for their preceptor?
Well, I have lots of advice. The first thing that I'd like to say is that this is one of the hardest jobs I've ever done, if not the hardest. Mm-hmm. Finding a preceptor is really difficult, and I think there's lots of students out there and former students who would agree. They've been through the trauma. So just know that it is super difficult, so much so that we have a staff of people working 24/7, 365 days a year, doing what you're trying to do on your own time, even though you're working part or full time, and they have a family. And so, it's a difficult thing. And just like you are, we get lots of no's every day. So you just have to, first of all, hang in there, because it is a difficult thing, and keep trying. But the first thing I would say is to start early. And when I say early, I would say up to a year in advance. Even earlier than that, start your networking. So when you're in your didactic portion and you start school, as soon as you get into a program, start your networking. Start thinking about everybody as a potential resource for you. So whether it's your own physician, or your friend's physician, or your parents' physician, or a neighbor, anybody is a potential resource for you. At least a minimum of 3 months in advance before your clinical rotation, but that's really the minimum. Mm-hmm. I would recommend somewhere between 6 and 12 months. So you can get the contracting done, because contracting, depending on the location, can take several months to get done, but at least 3 months in advance.
Okay. And when you get your list of resources, your preceptors down, how do you first approach your preceptor? What are the steps for that?
Well, the first thing I would do is, if you're looking for an office situation, is I would make sure that you have a nice polished resume. That's really important. Also, I would have a cover letter that describes yourself and your strengths, and make sure that you have your dates for your clinical rotation, that you're searching for your preceptor, and how many hours are required for the clinical rotation. Because if you do get somebody who says they might consider it, you want to have all of that information right at your fingertips.
Right. Okay. What about contracting? Do I take the contract in right when I show up, or do I wait on that?
I would wait on that.
Okay.
And the simpler the contract, if you have an option to use a simple versus 50-page big affiliation agreement, if a place lets you use the simple contract, try to use the simple contract.
Okay. So it sounds like a job interview. You're going in, you're selling yourself. Is it necessary to go on site to the preceptor's office? Can I just call them on the phone? What do you recommend for that?
That's a great question. So personally, I think if you can present yourself in person, that is the best way. It's harder to say no to someone face to face than just a simple phone call. If you think about it, it's real easy to say no to a solicitor, but when you see their pleading little face there in your office, and somebody's put on an effort to dress appropriately and professionally, which is really important when you do go in, almost pretend like it's a mini job interview. Go in, no plunging necklines, no tattoos showing, no fishnet stockings. Go in prepared with your resume, prepared with your cover letter, and looking prepared and ready to go, because you never know, the office manager or even the provider, one of the providers, may be willing to talk to you on the spot just to see if perhaps they would take you. I would say what I would recommend is start asking for the office manager, and if, they may or may not be available, they're very busy, but, make a friend with somebody, some friendly face in there. Anybody is a potential door to be opened for you. So whether it's the front office person or a medical assistant or the office manager or, a physician assistant or nurse practitioner, anybody can potentially open that door for you.
Okay. And if I can't show up in person, I want to maybe do my clinical out of state, I'm in a compact state, is it okay to email and call? What's the best way to make that, overture?
Well, I would say that the next best thing is probably a phone call. If they just receive an email or a letter in the mail, I just think it's easier for a person to just toss that aside or delete it. So if you can, I would say the next best step would be a phone call, and then follow it up. If you have a little tiny window of opportunity, if somebody expresses interest or you think maybe there's a possibility there, follow up with a personalized letter and your resume, again, polished and professional looking, and see if you can open that door a little bit further. And sometimes they'll let you do an interview, and again, you want to take that very seriously because you got a lot of competition out there. There's a lot of students looking for the same thing you are.
And what about, is there anything else I should bring with me other than my resume? Any tips on my resume? Anything like that?
Just again, make sure that it's polished and professional and that you sell yourself. I would say in your cover letter, make sure you talk about any skills you have. For example, if you're doing a pediatric rotation and that's what you're looking for, which peds is really hard to find. It's one of the harder sites, and GYN, especially for males. But I would say try to focus on things that, even though maybe you've never worked in peds, mention the fact that you've taken care of lots of pediatrics in your personal life, or that you've got children of your own. You can decide whether you want to say that or not. But try to sell yourself as best you can so that it does show that you have some background.
Okay. And what other kinds of places would I go to meet a preceptor if I'm a student? Are there other places where I might be able to get connected?
Well, I'm a huge proponent of our local and state nurse practitioner organizations. I would encourage everybody to become a member of your locals and state, and or in California, the local and state are kind of the same. But I'm a big proponent, and I encourage students and nurse practitioners to go to meetings and to talk to the leadership there and ask if you can speak, if you can stand up and plead your case and your need for a preceptor. Introduce yourself, be confident, this is not the time to be shy and quiet, but be confident and sell yourself, because again, you're competing against a lot of other people, and if you get a tiny little window, someone that asks you questions or seems interested, follow up afterwards, go up to them and ask them personally, would you consider precepting? I really want to work with you.
Okay, and maybe get their information, their phone number, and all that
exactly.
stuff. What happens when I am turned down by a preceptor? They just turn me down flat. Is there anything I need to do after that happens?
Yeah, it's going to happen, I'm afraid. It's just the reality of the world in which we live in. Try not to get discouraged. Again, if you felt like there was a crack of a door being opened, a possibility, follow up, because you never know. Another thing I would do is any person you talk to, even if they say no, ask if they have a suggestion of somebody else that might be a good resource for you, if they have another colleague that you might try, because the word of mouth is huge.
Yeah, absolutely. And if all else fails and I can't find my own preceptor, how do I get a hold of you and your team to help me?
Well, yes, we're here. We're here, and we do this difficult job, and again, we have an entire team that works on this every day, long into the night, and across the nation, because this is a nationwide problem. So our website is www.PreceptorLink.com, and so please do reach out to us if you need us. Hopefully this video has given you some tips and some help. And we are here. We truly are trying to help solve this problem. we're working on other things. This is a temporary solution that
Yeah.
hopefully we can come up with some bigger, better ideas, and we truly are working on these. So I want to thank my colleague Lori Sargent, and have a great day, and good luck to you out there, and continue the fight for Preceptor Search Traumatic Stress Disorder.
Bye-bye.
Bye.